Hey everybody, welcome back. This lesson is about the liver and gallbladder as seen in CT imaging. We'll start with an illustration. This is an illustration of the anatomy of the liver and gallbladder. We discuss them together because these are the principal organs of the right upper quadrant and because the liver and gallbladder cooperate with each other as part of the biliary system. The liver produces bile, a digestive fluid, and the gallbladder stores and secretes it. In this illustration, we can see the right and left lobes of the liver. There are 4 total lobes, but the right and left lobes are the largest. The right lobe is very large, filling almost the entire right upper quadrant. The falciform ligament can be observed at the division between the right and left lobes of the liver. This ligament is not between the lobes, but it is observed on the surface of the liver at this position. The gallbladder is a small pear-shaped sac within a shallow cavity on the inferior surface of the liver. The gallbladder serves to store and express bile for digestion. There are several bile ducts associated with the liver and gallbladder. Bile produced by the liver travels through the common hepatic duct and then the cystic duct on the way to the gallbladder. When that bile is needed for digestion in the gastrointestinal tract, the gallbladder contracts to empty bile back through the cystic duct and into the common bile duct, where bile then empties into the duodenum of the small bowel. This illustration also shows us the unique vascular system of the liver. The liver has a dual blood supply. It receives venous blood from the portal vein, which itself receives blood from the superior mesenteric vein, the inferior mesenteric vein, and the splenic vein. The portal vein brings nutrients absorbed from the intestines into the liver, where the cells process the nutrients. CT imaging of the abdomen is commonly performed during portal venous phase. That is, when the contrast is leaving the gastrointestinal system and arriving at the liver through this portal venous system. The arterial blood supply to the liver originates from the common hepatic artery, one of the 3 branches of the celiac trunk. Finally, the blood drains back out of the liver and into the inferior vena cava by way of the hepatic veins. Next, we'll look at the liver and gallbladder in the coronal plane. This is a CT image of the abdomen and pelvis in the coronal plane. The image has been processed with a standard algorithm, and we are displaying the image with the usual windowing technique for soft tissue. That's about 400 window width and 40 window level. Notice that this patient has had 2 forms of iodinated contrast. The patient received intravenous contrast, and the patient was scanned during portal venous phase. That's about 60 or 70 seconds after the initiation of contrast injection. It's also clear that the patient received oral contrast because the stomach, small bowel, and the proximal large bowel are all bright white with hyperdense contrast. We can see the right and left lobes of the liver. The right lobe is very large, filling almost the entire right upper quadrant. We can also see a segment of the falciform ligament on the surface of the liver between the right and left lobes. We can see the gallbladder, this pear-shaped organ on the inferior surface of the liver. In CT imaging, the gallbladder can appear with somewhat different shapes and sizes, but it will always be in this position, and it should always be homogeneous. In other words, it should be a uniform shade of gray. Any irregularities in the wall or content of the gallbladder indicates a pathology. Take note of some of the surrounding gastrointestinal structures. We can see the contrast-filled stomach in the left upper quadrant adjacent to the left lobe of the liver. We can also see the duodenum, the first segment of the small bowel. This segment of the small bowel is important when discussing the liver and gallbladder because bile from the gallbladder empties into the duodenum. Moving posteriorly in the coronal plane, we can again see the right and left lobes of the liver. We can see the gallbladder on the inferior surface of the liver. We can see the stomach adjacent to the left lobe of the liver. Now at the midline of the liver, we can see a segment of the portal vein. This is the vein that receives the venous drainage from the spleen and the gastrointestinal tract. This blood supply to the liver is low in oxygen, but it is very rich in nutrients. The rest of the abdominal and pelvic content at this slice position is mostly small bowel, with a few segments of large bowel, all of which is opacified with oral contrast. Moving posteriorly in the coronal plane, this is a very important slice position. We can see a segment of the gallbladder, and now Now we can see a segment of the cystic duct. This is the duct or tube that allows bile to go in and out of the gallbladder. CT imaging is not usually used for direct evaluation of the biliary system, but we can see this structure. This slice position also gives us an excellent view of the portal venous system. This is the portal vein. It's formed by the confluence of three major vessels, all of which can be seen in this slice position: the splenic vein, the inferior mesenteric vein, as well as the superior mesenteric vein. These veins are unique in the body because they do not drain directly into the inferior vena cava. They deliver nutrient-rich blood into the liver for processing. Then, after processing, that venous drainage is then supplied back to the heart by way of the inferior vena cava, moving posteriorly in the coronal plane. Notice again the right and left lobes of the liver. On the inferior surface of the liver, we can see the neck of the gallbladder as well as the cystic duct. We can also see the portal vein entering into the liver. The portal vein immediately bifurcates into right and left hepatic portal veins. Now we'll look at an axial view of the upper abdomen. This is an axial view of the same scan. We can see all of the same structures but in a different orientation. Notice that we are at the top of the abdominal cavity. We can see the right and left lobes of the liver. The right lobe is very large, filling almost the entire right upper quadrant. The left lobe of the liver is much smaller, and it shares the left upper quadrant with the stomach, the spleen, and the upper pole of the left kidney. The liver, spleen, and kidneys will all look very similar in every patient, but the stomach can vary significantly in size, shape, and position. The stomach is a very elastic muscular structure, so it changes in size depending on what the patient has consumed. In this patient, the stomach is fairly dilated because the patient has been drinking oral contrast. That's why the stomach is large and bright white with contrast. Take note of two significant vascular structures. We can see the inferior vena cava on the right side of the spine, and we can see the aorta slightly left of midline. Because we are at the upper portion of the abdominal cavity, we can see the lung bases, and we can see a segment of the diaphragm where it separates the thoracic cavity from the abdominal cavity. This particular segment of the diaphragm is called the crus. It's the tendon that ultimately attaches the diaphragm to the spine. Moving inferiorly in the axial plane, we're still seeing the right and left lobes of the liver. Now we can see the right and left portal veins. These are the primary branches of the portal vein that supply nutrient-rich blood from the gastrointestinal system into the liver for processing. The portal venous system is well opacified with contrast because the scan was timed intentionally to demonstrate maximum opacification of the portal venous system. At this slice position, we can see a very important vascular structure. This is the celiac trunk, the first abdominal branch of the aorta. This is significant in the context of this lesson because the celiac trunk trifurcates into three vessels, one of which is the common hepatic artery, which supplies oxygenated blood to the liver, moving inferiorly in the axial plane. At this slice position, we can see a few important vascular structures. This is the common hepatic artery we just discussed. It's the branch of the celiac trunk that supplies oxygenated blood into the liver. We can also see one branch of the portal vein, the right portal vein. On the posterior margin of the pancreas, we can see this vessel, which is the splenic vein. The splenic vein is usually easy to find because it leaves the spleen and follows the posterior contour of the pancreas. The splenic vein is important because it's one of the three major vessels that converge to form the portal vein, moving inferiorly in the axial plane. This again is the liver, and now we can see the gallbladder on its inferior surface. We can also see some relevant features of the gastrointestinal tract. This is the stomach filled with both contrast and air. The stomach empties into the small bowel. We can see the first segment of the small bowel called the duodenum, and the second segment of the small bowel called the jejunum. The duodenum is significant in the context of this lesson because bile formed in the liver and collected by the gallbladder is ultimately excreted excreted into the duodenum. One more axial image. We can still see the liver as well as the gallbladder on its inferior surface. Notice that the gallbladder is well distended with bile. Bile is homogeneous, so the gallbladder is displayed with a uniform shade of gray. Any variation in the walls of the gallbladder or the content of the gallbladder indicates a pathology. At this slice position, we can again see the stomach as well as the second segment of the small bowel called the jejunum. Thanks for watching. That's been a review of the liver and gallbladder as demonstrated in CT imaging.